Yesterday, the White House announced that in the first month, more than 100,000 Americans successfully enrolled in new insurance plans. Is that as high a number as we'd like? Absolutely not. But it does mean that people want affordable health care. The problems of the website have prevented too many Americans from completing the enrollment process, and that's on us, not on them. But there's no question that there's real demand for quality, affordable health insurance. I completely get how upsetting this can be for a lot of Americans, particularly after assurances they heard from me that if they had a plan that they liked, they could keep it. And to those Americans, I hear you loud and clear. I said that I would do everything we can to fix this problem, and today I'm offering an idea that will help do it. Already, people who have plans that predate the Affordable Care Act can keep those plans if they haven't changed. That was already in the law. That's what's called a grandfather clause that was included in the law. Today we're going to extend that principle both to people whose plans have changed since the law took effect and to people who bought plans since the law took effect. So state insurance commissioners still have the power to decide what plans can and can't be sold in their states, but the bottom line is insurers can extend current plans that would otherwise be canceled into 2014, and Americans whose plans have been canceled can choose to re-enroll in the same kind of plan. With respect to the pledge I made that if you like your plan, you can keep it. I think, and I've said in interviews, that there is no doubt that the way I put that forward unequivocally ended up not being accurate. It was not because of my intention not to deliver on that commitment and that promise. We put a grandfather clause into the law, but it was insufficient. Keep in mind that the individual market accounts for 5% of the population. So when I said you can keep your health care, I'm looking at folks who've got employer-based health care, I'm looking at folks who've got Medicare and Medicaid, and that accounts for the vast majority of Americans. And then for people who don't have any health insurance at all, obviously that didn't apply. My commitment to them was you're going to be able to get affordable health care for the first time. You have an individual market that accounts for about 5% of the population, and our working assumption was, my working assumption was, that the majority of those folks would find better policies at lower costs or the same costs in the marketplaces, and that the universe of folks who potentially would not find a better deal in the marketplaces, the grandfather clause would work sufficiently for them. And it didn't. And again, that's on us, which is why that's on me. And that's why I'm trying to fix it. And as I said earlier, I guess last week, and I will repeat, that's something I deeply regret because it's scary getting a cancellation notice. I understand why folks are frustrated. I would be too, because sometimes people look at what's taking place in Washington and they say not enough is getting done that helps me with my life. And regardless of what Congress does, ultimately I'm the President of the United States, and they expect me to do something about it. So in terms of how I intend to approach it, I'm just going to keep on working as hard as I can around the priorities that the American people care about. And I think it's legitimate for them to expect me to have to win back some credibility on this health care law in particular and on a whole range of these issues in general.